So, Mira, if someone wants to go about finding a clinical trial, how do they do that?
Yeah, that's a really good question, Ivy. And I'll be honest, this is often more challenging than it should be to actually find a clinical trial. So I would say a good first step is to ask your oncologist. And not all oncologists may know all of the trials off the top of their head. There are many clinical trials and they're changing all the time. And so even for oncologists, they may not know upfront, but they can help you search. And it's important to mention to your oncologist if you might be interested in searching for a clinical trial, even if you might not be eligible for one at the beginning of your diagnosis. It's important to at least have a sense of what opportunities might be available down the line, and your oncologist can help you think about that. It's good to ask about trials that are happening at your own institution. Sometimes there may be multiple groups at your own institution that may be running different trials. For example, many institutions have a separate group that only runs phase 1 trials. And then there may be a separate group, for example, Ivy and I both treat lung cancer. The lung cancer group may run some of the phase 2 and phase 3 trials. And so asking about the different groups who run different trials at your institution can be helpful. It's good to ask about trials at nearby institutions as well. If you're seen in a community setting, asking about trials that may be available at some of the academic centers that may be close by. And so one example here is Longevity, which is a lung cancer foundation. They actually have a trial matching software, and they have navigators who can help patients look for clinical trials they may be eligible for based on the things that Ivy mentioned, stage and biomarkers, and other sort of parameters as part of your disease. Similarly, the Leukemia Lymphoma Society has a clinical trial sort of navigation program. And then clinicaltrials.gov is where all clinical trials will be registered. I'll be honest, it's often difficult to search, although many patients do start here just to get a sense of what trials may be available. And again, your oncologist can help you do this if it's of interest. All right. So if you meet kind of broad matching criteria and you find a trial you might be eligible for, the next step is to meet with the trial team. And it's important to know that even if you are interested in a trial, and even if there's a trial that may be a good fit, it can sometimes take weeks to even months to get on a trial. Sometimes additional testing, additional biopsies are needed. And so again, it's good to establish if a trial might be an option, even if it's not right now. It's good to at least establish that relationship with the trial team. So down the line, it's easier to get on the trial when you may be eligible. And then when you meet with the trial team, if you agree to, if the trial seems of interest and you're interested in proceeding, you would sign a consent form. Additional testing may be required after you sign the consent form, and specific eligibility criteria like blood work, and where the disease has spread to can all inform whether or not you ultimately may be eligible for the trial. So it can sometimes feel like a long process, and again, your oncologist can help kind of walk you through that process. But Ivy, when patients are going to these visits to meet with clinical trial teams, what kinds of questions should they be asking?
Well, the patients, you are allowed to ask as many questions as you like. And I would say, like, here are some advice, and we can start asking some questions about treatment. Some of the most important questions that we suggest are like, will I know ahead of time which treatment am I assigned to? Is the standard of care treatment truly a standard of care? Is it what I would get if I didn't enroll in the trial? What are the alternatives to enrolling on the trial?
Those are great. You can also ask about potential side effects of the drug, of the new drug that's being tested on the trial. Sometimes there will be some things that are already known about this drug, like if it's been used in other cancer types or in other disease states. You can ask, is there anything published yet about this drug? Things that I can read about to learn more about the drug. And some drugs may be totally new, and others may be more established again in other disease types and then being tested in a new type of cancer. You can ask how the drug works. What's the theory behind why this drug may work for my specific cancer? And you can always ask the oncologist or the person who's running the trial for their opinion. Do they think the benefits outweigh the risks? Not every trial is a good fit for every patient. And oncologists and trial teams should give a balanced view of the pros and cons of enrolling on a trial. I want to highlight that patients should never feel like they're being pressured to enroll on a clinical trial. Like Ivy said, it's your choice. And it's something that your oncologist should help you think about, but you should never feel like you're being pressured or coerced to enroll in a clinical trial.